Thank you so much for joining me today, and may I welcome you to the poster sessions of the 2009 annual meeting of the American Society of Nephrology. We are in beautiful San Diego, California for this year's meeting, and I should initially introduce myself before we enter the exhibition hall to view the displayed posters. I am Andrew Welton, Professor of Medicine Adjunct at the Johns Hopkins University School of Medicine in Baltimore, Maryland, and I would like to share with you the highlights of a gout-related study that I and my colleagues have on display today as part of the scientific poster sessions of the American Society of Nephrology. Come along with me and let's enter the poster display session. The thrust of our gout study was related to the issue of renal impairment complicating gout management and the effectiveness and safety of the xanthine oxidase inhibitors allopurinol and febuxostat, also known as Uloric, that both lower serum urate levels. Allopurinol, as you will recall, has been available for some 40 years, whereas febuxostat was approved for clinical use by our FDA colleagues earlier this year. Of particular renal interest is the fact that febuxostat, or Uloric, is virtually totally metabolized by the liver, with less than 4% of unchanged drug appearing in the urine, and as a result, in mild and moderate renal impairment, no dosing modification is required. This, of course, is in contrast to allopurinol and its major active metabolite, oxypurinol, which are eliminated almost entirely by the kidney and thereby require cautious dose reduction in renal impairment. As you will recall, it is the accumulation of oxypurinol in renal impairment that may be an important contributing factor to the development of the hypersensitivity syndrome. The object of our study was to compare the urate-lowering efficacy and safety of febuxostat, or Uloric, and allopurinol when studied for 6 months in subjects with hyperuricemia and gout who had either normal or impaired renal function at the time of study. It is perhaps of interest to note that this is, to date, the largest head-to-head comparison of allopurinol and febuxostat in the management of gout. In this study, we assessed the ability of these drugs to achieve a goal serum urate of less than 6 milligrams per deciliter, since this is persistently below the urate saturation or precipitation point of 6.8 milligrams per deciliter in the systemic circulation at core body temperature. Remarkably, in this non-selective, or what we might call all-comers gout study, a full 65% of the study subjects manifested mild to moderate renal impairment at the time of study recruitment. As you will recall, this spans the renal function range of 30 through 90 milliliters per minute of glomerular filtration rate, and in this study we measured GFR as estimated creatinine clearance. We studied a total of 2,269 patients who received either febuxostat, Uloric, at doses of 40 or 80 milligrams per day, or allopurinol at 300 milligrams per day, except in the allopurinol-treated subjects with moderate renal impairment, wherein we used 200 milligrams per day. As you may recall, by convention, patients with moderate renal impairment have a glomerular filtration rate in the range of 30 to 59 milliliters per minute. I might add that The demographics of the study groups of febuxostat and allopurinol were comparable, and the drugs were well tolerated and comparably safe throughout the investigation. We found that febuxostat, 80 milligrams per day, provided superior lowering of serum urate when compared to febuxostat 40 milligrams a day or allopurinol in patients with mild or moderate renal impairment. Additionally, we found that both doses of febuxostat were superior to allopurinol in lowering serum urate in gout patients with mild or moderate renal impairment. In fact, the poorest efficacy response to allopurinol was in the study subjects with moderate renal impairment, and this most likely reflected the typically employed drug dose reduction needed in such patients. I would again point out that febuxostat or Uloric does not require dose reduction in mild or moderate renal impairment, but that one must be cautious when using it in severe renal impairment, since clinical data are limited in such individuals and it is not as yet approved for use at that level of severe renal impairment. Actually, we are currently investigating this issue, and hopefully we will be in a position to present to you such information at an upcoming national scientific meeting. Again, many thanks for joining me, and I hope you'll enjoy the other scientific posters on display at this meeting.